I have fielded many questions and objections to the mini-fast program over the last year or so. Here are some of them. I don't have time to exercise in the morning. Well, morning exercise is hard for many people at first, but most manage to fit it into their schedule, and eventually it becomes a habit. If you are unable to exercise in the morning, however, you may exercise in the late afternoon or evening and skip the evening meal rather than breakfast. Do your best to exercise at least 5 days a week, regardless of when you do it. I like the idea, but I'm in such bad shape I can't really exercise. This is kind of a catch-all excuse, unfortunately. Anybody can go for a short walk. You have to start off short and easy. Everyone should start an exercise program at a low to moderate level of activity and gradually build up. There isn't anyone who can't develop some form of exercise regimen. So you need to put that excuse away. I can't go without breakfast. I say, sure you can. You just haven't tried it, most likely, or rather you haven't tried it with exercise or with the intention of seriously doing it. You'd be surprised at how effectively fat burning, which is what happens when you skip breakfast and exercise in the morning, curbs appetite. And if you also take the recommended supplements, hunger will not be an issue. That I can almost promise. I've never been successful on any diet before. Even if I lose, I gain it back. Well, welcome to the crowd. Virtually everyone who goes on a diet program almost always gains it back. That's one of the Achilles tendons of virtually every weight loss program. Now, regaining lost weight is almost inevitable for virtually everyone who goes on a conventional low-calorie diet or exercise regimen. But this is time-limited and only followed for a finite period of time. The beauty of the mini-fast with exercise program is that you can continue it indefinitely. You don't ever have to go off your weight loss program. That's what makes it different. It's not a diet, it's a way of life. 3 months is a long time. I'm not sure I can stick with it. Sure you can. You simply have to experience it and put it into practice and allow it to become a habit, and in no time, 3 months will be here and gone. I'm already taking a lot of supplements. Do I really need to take these new supplements? The supplements, I've said, are only an adjunct to the program. I think they're important. They accelerate weight loss and they help reduce hunger, and they are particularly helpful for patients who have diabetes. But they're not essential. You can do the program without the supplements. I don't want to give up my favorite foods. Well, don't give them up. Just don't eat them for breakfast. And try to eat them in moderation. If your favorite foods happen to be unhealthy or high-calorie foods, you're doing yourself a favor by not eating them at breakfast and cutting down on the amounts you're eating during the day. I'm concerned I'll get too tired or my blood sugar will get too low. Now, our experience has been that blood sugar does not drop precipitously or even predictably. People adapt well to this regimen, and the majority of those who have this particular concern often have never given the mini-fast a try. They just presume that it would be difficult and use this as an excuse not to try it. I suspect that anyone who does want to follow this program will reap its benefits, would be able to do so with ease and without excessive fatigue or low blood sugar concerns. Of course, if you're taking medication, especially insulin, it may be another story. You need to talk to your doctor before beginning this or any other exercise or diet regimen.